Welcome to the Dental Hub. At the Dental Hub, we're committed to providing you with the most exceptional care in a compassionate and friendly atmosphere. Today we are going to know some interesting topics about dental health.
Post-operative instructions for dental extraction. Post-operative care is crucial for proper healing after a dental extraction. Here are some general instructions to follow. Bite on gauze. After the extraction, the dentist will place a gauze pad over the extraction site. Bite down gently but firmly on the gauze for about 30 minutes. Do not spit or gargle. This helps in clot formation and controls bleeding. If bleeding persists, replace the gauze pad as necessary. Minimize physical activity. Avoid strenuous activities and exercise for at least 24 hours after the extraction. Physical exertion can increase blood flow and delay the healing process. Take prescribed medications. Follow your dentist's instructions regarding prescribed pain medications, antibiotics, or any other medications. Take them as directed to manage pain, prevent infection, and promote healing. Apply ice packs. Use ice packs on the outside of your face near the extraction site for the first 24 hours. Apply for 15 minutes on, then 15 minutes off, to reduce swelling and discomfort. Maintain oral hygiene. Brush your teeth gently but avoid the extraction site for the first 24 hours. Rinse your mouth with warm salt water, half teaspoon of salt in 8 ounces of water, after the first day. Be cautious not to spit forcefully, as it may dislodge the blood clot. Soft diet. Stick to soft, cool foods for the first few days after the extraction. Avoid hot, spicy, or hard foods that can irritate the extraction site. Gradually reintroduce solid foods as the area heals. Avoid smoking and alcohol. Smoking can delay healing and increase the risk of complications. It's best to avoid smoking and consuming alcohol for at least 72 hours after the extraction. Swelling and discomfort. Some swelling, bruising, and discomfort are normal after an extraction. To manage swelling, apply ice packs as mentioned earlier. Over-the-counter pain relievers such as acetaminophen or ibuprofen can help alleviate discomfort, but follow the dosage instructions. Avoid touching the area. Refrain from touching the extraction site with your tongue, fingers, or any foreign objects. This reduces the risk of infection and promotes healing. Follow-up appointment. Attend any scheduled follow-up appointments with your dentist to monitor the healing progress and remove any stitches if necessary. Remember, these instructions are general guidelines, and it's important to follow the specific instructions given by your dentist. If you experience excessive bleeding, severe pain, fever, persistent swelling, or any other concerning symptoms, contact your dentist immediately.
Thanks for watching. We at the Dental Hub strive to treat you with best possible way because your smile is our milestone. Hit the follow and subscribe button.